I do not think it's appropriate to put children on an experimental, which is still, I would regard, as a kind of experiment, when we know that the drugs have serious consequences and damaging consequences. So why would we put children in a position like that?
So, Kamal, the closure of the Tavistock Clinic last year following that scathing report by Dame Hilary Cass, I think marked the end of an era of a highly medicalised approach to the treatment of young people with gender-related distress. And just to explain, the Tavistock Clinic in general provides psychiatric and psychoanalysis care to children and adults. But as a part of the Tavistock, there was this Gender Identity Development Service, or GIDS, which ended up being the place for referrals for children across England and Wales suffering what some claim to be gender dysphoria, others would describe as gender distress. It was followed up by the new Health Secretary, Wes Streeting, saying in December that he thinks that puberty blockers for the under 18 should be banned. There was this consensus after many, many years of extremely angry and difficult debate that actually this medicalised pathway, largely fueled by ideology, wasn't the right approach to take to children who had very many different complex medical issues. And actually that the debate had become so politicised that it sort of turned a blind eye to the safeguarding of the children in the care of the Tavistock and other clinics.
And I think a lot of us thought that the CAS review had put to bed so many of these toxic issues. She concluded that the clinic, the Tavistock Clinic itself, was implementing innovative, in inverted commas, changes in care without a well-considered evidence base. She said that the evidence base about the use of puberty blockers was remarkably weak. But it was announced last week, Camilla, that the NHS, despite the CAS report, despite what the Health Secretary has said, is now planning to start clinical trials where puberty blockers will again be prescribed for people under the age of 18. We are talking here in the main about England and Wales. Scotland does have a much more permissive approach to the treatment of trans issues.
So before we bring Dr. David Bell into the conversation, just a very brief potted history of his career. He's a retired psychiatrist and psychoanalyst. He was one of the original whistleblowers. In 2018, he wrote a very controversial at the time report about the Gender Identity Development Service called GIDS at the Tavistock Clinic, which is part of the Portman NHS Foundation Trust in North London. He had worked in adult services there from 1995 until his retirement 4 years ago. His report then preempted a High Court ruling from December 2020 that children under 16 were unlikely to be mature enough to give informed consent to the prescription of puberty blockers. That ruling was then overturned by the Court of Appeal in 2021, but the Conservative government brought in a ban in 2024 that has been upheld by Wes Streeting.
Dr. David Bell, welcome to the Daily Tea. Thank you so much for your time. Just before we get into the precise issues about this new clinical trial, give us some of your background in this area.
That's quite a long story, but I'll give you the basics. I was a consultant psychiatrist and psychoanalyst working at the Tavistock, and I worked there for 25 years. I retired in 2021. And in 2017, 18, around that time, I was on what was called the Council of Governors. So I was a governor of the Tavistock, as well as being a staff member. And I was the staff, the academic and clinical staff representative on the council. And so we had oversight of the trust. And I already had some quite serious concerns about GIDS, the Gender Identity Development Service. I was very concerned about just hearing things. I wasn't directly involved, but I keep hearing about these very young children who were distressed and confused being started on this medical pathway to change their gender. And I expressed some of those concerns in various places, but it reached the real point was when someone knocked on my door, and that was some of the staff knocked on my door literally, and came to talk to me about their great concerns about what they saw, rightly as it turned out, as the serious mistreatment of children and adolescents in the GIDS department. And first of all, it was one, then it was two, and then about a third of them talked to me, and that led me to write a very critical report trying to alert the Trust to the serious, very serious mistreatment of these children. The Trust tried to suppress that and wouldn't really hear what I was saying. And eventually what happened was it was leaked by someone to the press, my report. And that, together with various other organizations, big organizations and parents who've been raising serious concerns, it became a much more public knowledge at that time. And that was part of the process. I was very much part of the process eventually leading to what became known as the CAS review. And the CAS review led to the closure of GIDS and the banning of puberty blockers on the NHS.
Dr. Bell, can you just put into context, back in the day when you first started as a psychiatrist, did you see many cases of children in gender distress? Because I think people talk about this issue in the context of the last 5 to 10 years. And what was quite stunning about the Tavistock's numbers was how sharply the number of patients you were dealing with there increased over a very short period.
Well, that's right. When the unit started, say, I mean, I don't have to be precise here, but say about 10 years before all this, maybe a bit more, there used to be 30 to 50 patients a year being referred nationally. And that went up to 3,000. And the reasons it went up are complex, but a very, very important one is it seemed to hit a kind of cultural wave. So that children with all sorts of problems, complicated problems, as this is what the staff were telling me, children struggling with autism, with depression, with histories of trauma, with great confusions about their sexual identity, grave family problems, children just lost in the world, and so on. They were presenting their problems as gender distress because that became the vehicle for some reason. And that's one of the things that happens in psychiatry, that ways of presenting symptoms change according to cultural context. So this new cultural context created the ambient for all sorts of complicated problems to be presented in that way. But then the problem was that a reasonable clinician might have been alert to that. But instead, the clinical services was captured. Not the ordinary clinical care had been captured and overtaken by an ideology that claimed that these children really were in the wrong body. And what the clinicians needed to do was to help them change into a different body through stopping puberty. And then they would go on to puberty, onto opposite sex hormones, and many onto surgery. So they're being started on a medical and potentially surgical pathway as a result of the invasion of the service by an ideology that it was very difficult to question. The clinicians who came to me secretly. They wouldn't even see me in my room at the Tavistock. They came to my consulting room because they were frightened of being seen, because they were so intimidated for raising concerns.
Why did the ideology become so aggressive?
Well, that's a very interesting point. I think we'll want to have to answer that in terms of the ideology itself, but also in terms of a cultural kind of shift. What I'm referring to is a cultural shift in which it became increasingly difficult to raise questions and doubts about movements which gathered this kind of momentum, really. It perhaps is related to a world in which, to put it very loosely, and this would require a lot of explanation, but I think you'll get the sense of what I mean, in which the struggle for truth and understanding was overtaken by a determination that a certain ideology must be followed, must be obeyed in a way. So that was true in various areas, that the ordinary struggles for truth and understanding became rather overtaken by a relativization of truth, by what's sometimes called extreme postmodernism, where what seems to matter is not so much truth and understanding, but the demands of a kind of political culture, political there with a small p. I don't think that really answers your question, but it goes some way. I think perhaps a further point would be something a bit more profound, and that is, and here I'm following the work of a philosopher called Adorno, that is that when movements become possessed by an idea, they do have ordinary sane doubts, but they can't own the fact that they have those doubts, because if they have those doubts, the whole thing is threatened. So they cannot tolerate doubts. And then people who raise doubts become the enemy. So it's like it's not so much the message that gets listened to, but instead the messenger gets punished for raising doubts. And I think that's certainly the case, because the individuals who I was speaking to, when they raised doubts, were told, "You're transphobic. You're a transphobe. This is hate speech. You must be silenced." Who have you been talking to? Have you talked to David Bell? So it became that kind of tyranny which people were very familiar with.
And Dr. Bell, even after Dame Hilary Cass produced this report that was obviously based on evidence, and the key finding was that the clinic was implementing innovative changes in care without a well-considered evidence base, it raised huge concerns about child safeguarding at the Tavistock. The Tavistock is subsequently closed. We have in December the Health Secretary, Wes Streeting, saying that prescriptions for puberty blockers for the under 18s should be banned. So we do witness a complete sea change. Just to understand where you're coming from a psychiatric perspective, do you disagree with puberty blockers being given to any child under 18?
Yeah, I'd say I'm a psychiatrist and I'm also a psychoanalyst, and it's both those disciplines that are so core to the way I think about things. And of course, as a psychoanalyst, I'm acutely aware of human psychology being a developmental process. And the crucial point of development, of course, is infancy, childhood, and adolescence. So that's a perspective I come at it from. When you say, am I against, it's in a way it's the right kind of word, but against, it positions me as a kind of, an enemy of. I'd rather talk about what I'm for.
Sure.
And what I'm for is that children, see, I don't use the expression anymore, gender dysphoria. I use the expression children who are expressing their problems through distress in relation to their gender identity. And what we know is that those children are very complicated and have difficult problems. They include, figures vary, but around about 35% are on the autism spectrum. Many have complex family situations, often recent traumatic situations. Many have very disturbing, very disturbed and confused states about their own sexuality, whether they're gay or lesbian or so on. Many of them, there's histories of, family histories of abuse and things. I'm not talking about the children being abused, but sometimes in the family histories, there's histories of abuse, all sorts of things I could name. But the point I'm making is and this is the point that Hilary Cass made, that once the, in inverted commas, the diagnosis of gender, of being transgender is made, it has the effect now that everything is seen through that lens. Cass called it diagnostic overshadowing. And she says in her report that these children deserve the same clinical care as other children, and they weren't getting it. And that was because of this ideological penetration into the clinical domain. So once these children were called transgender, then everything is seen through that. So to come back to your question, no child should be put on an irreversible medical pathway at a point in their life where they're going through such turmoil. There are so many difficulties that even an ordinary child is facing, let alone this population who often got many other difficulties. What they need is a psychotherapeutic, it doesn't have to be psychotherapy, but a psychotherapeutically informed engagement with them over a lengthy period of time, so that the child can learn to trust the person and can learn to think about how they've come. What is the trajectory? How did they come to believe themselves, for example, to be in the wrong body? And how did they come to believe that the only solution is to get out of this body? Now, if you put them on puberty blockers, you are in effect saying this problem is a gender problem. That's not true. And secondly, you're saying we will solve all your problems through stopping puberty. That's also not true. So after saying that, the answer to your question is, I do not think it's appropriate to put children on an experimental, which is still, I would regard as a kind of experiment, when we know that the drugs have serious consequences and damaging consequences. So why would we put children in a position like that?
Given the points you've just made, Dr. Bell, and given that Wes Treating has said that puberty blockers should be banned for those under the age of 18, how do you respond to the fact that it has been announced in the last week that the NHS will start trialling puberty blockers for young people and adolescents?
Well, I'm quite shocked, because it seems to me that it's about as if one part of the mind doesn't recognize the implications of what the other part of the mind is saying. If we're saying, you see, one of the things we need to understand about puberty blockers, but I didn't quite make clear enough before, is that when the service started, those 10 or 15 or 20 years ago, about 80 or 90% of the children came off the puberty blockers and went through puberty. They'd been helped, in other words. Now, I don't think they should have been put on puberty blockers, but nevertheless, it wasn't quite so damaging. Now, 98% of children who go on puberty blockers do not come off them. They progress to opposite sex hormones and potentially to surgery. I say potentially because we don't know how many, because one of the very distressing parts of all this is that children were not followed up. But we know a lot of the children did go on to have surgery. We also know a lot of the children, increasing numbers we're hearing about as adults, regretted it, thought they made a terrible mistake. So I'm very shocked that, given that there's strong evidence of the damaging consequences of puberty blockers, that we will put any children on them, whether for a clinical trial or not, because by putting the children on them, we are exposing them again to harm and experimenting. The reason I say we're exposing the harm, we can sort of briefly, once a child is on puberty blockers, that putting them on a puberty blocker is freighted with the knowledge that they are very, very highly likely not be able to come off it. So we're putting them de facto on a medical pathway and saying to them, in effect, your problems are gender. It can be understood through the lens only of gender, and it will be, and we're starting them on that medical pathway. Secondly, there's quite a lot of evidence of interference with bone mineralization. I'm sure, you could get on some expert who'll say, oh no, that one of those studies that Dr. Bell is referring to, it's not quite like that, or we need to do that again. Nothing is ever airtight in this area. But what I'm saying is a sufficient concern about the effects on bone mineralization. There's a significant concern about the effects upon brain maturation. Now, what we know from animal studies is that puberty, at the moment of puberty, the brain is, so to speak, ready for puberty. And when the hormones start coming, many pathways fan out at a very, very rapid rate. And we know from animal studies, if you prevent puberty, that there's an interference in that process. And the body isn't like a video machine that you can press pause and then 2 years later restart, because the body is in a different position, the brain is in a different position, and of course, socioculturally, the child is in a different position. So the child is ready for puberty. And by stopping it, you're causing harm. By putting them on puberty blockers, they're not going to be able to get off them. And there's also, one increasingly hears about studies in which there are other concerns, for example, cardiovascular effects and so on. These are concerns. They're not, we know, because there haven't been enough follow-up. But if you were a parent knowing about all these concerns, could you agree for your child to be experimented upon?
Why do you think this has happened then, Dr. Bell? Because we saw the sort of tide turning on what I would describe as the trans lobby trying to dominate and control this issue. You've mentioned earlier, and I know that you have personally been the target of this sort of attempt to cancel people who disagree, this attempt to silence people who voice any dissent at all. So why are we now in a situation where we have the Cass review, the Tavistock's closed down, Wes Streeting himself has been quite vocal on this issue, and now, almost by the back door, we're seeing children being put back on puberty blockers?
Well, I don't know the answer to that question. Just before I get to that, I wanted to add something, and that is that I think there's very considerable grounds for ethical concern. I can't see how this can get passed. I'm frightened that it will, but I can't see how this is going to get past an ethical approval body, given what we know. If you trial a drug, suppose there's a new drug for an infection. So what do you do when you trial the drug? You see if it treats the infection, and then you see if there are any serious side effects. And is it better than the other drugs for treating the infection? It's quite simple in a way. But with this situation, it's different, because you're not seeing if the puberty blocker stops puberty. We know it does. And from my point of view, that is the harm. That is one of the major harms, that it stops puberty. So there's a sense in which it's quite odd. What is it they're going to measure? And as I understand it, and I haven't gone into detail, but one of the things they're going to measure is the psychological consequences of being on puberty blockers. But I don't understand how they're going to be able to, the child will know they're on puberty blockers, so they'll feel relieved they're on puberty blockers, they're not having puberty, and that'll have huge consequences for their mental state. But that is not proof that they work. That is proof that the child is relieved that they're on puberty blockers. But their concerns about why puberty is so distressing to them have never really been properly addressed. Why this is happening, I don't know. I'd be speculating, because it makes no sense at all. So I don't know why it's being done.
Could I put one point to you that is made from, as we've described it, the sort of ideology of trans, that by acting below the age of 18, we may be preventing suicides, that the alternative is that young people turn to taking their own life, and so that action, and in some cases medical action, needs to be taken. I just wondered what your response was to that argument.
Well, the response, I mean, it's shocking that people are saying that, you know. I know of parents being treated by gender services who were worried and skeptical and were told, let's say it's a girl, because we forget the majority of them are girls. Do you want a dead daughter or a live son? That was actually said to parents. And it's not true. There is no evidence at all for increased suicidality in this group. There is, if you compare them with a group who have, you know, because as I said, these children have multiple problems, multiple psychological problems, multiple psychological morbidities. If you compare them with other groups who have similar psychological morbidities, the rate of suicidal ideation is the same. There's no difference for this group. So there's absolutely, and Lewis Appleby, who's the nation's suicide czar, has actually gone online trying to caution organizations and people not to talk about this increased suicide in this group, because it has a very negative effect in terms of threatening people when there's absolutely no evidence for it.
Dr. Bell, can I just ask you about the politics of this? You've described yourself in the past as Corbyn supporting, so I'm going to extrapolate from that you consider yourself to be on the left. This does seem to have become a bit of a left-right issue, which is curious in itself, because we're talking about childcare, we're talking about safeguarding, we're talking about health, effectively. Mm-hmm. We now have these protestations from President Trump, these executive orders saying, you know, men are men, women are women. Also the executive order ruling out trans women from participating in women's sport. I mean, perhaps one of the problems is that the issue has become too politicised. What do you think?
Well, it depends what you mean by the term politicized. And it is interesting how different things are in America than here in terms of that degree of politicization between left and right. Because you're quite right. My own sort of political orientation is from the left. And part of the thing that's been so painful for me is in my younger years, I was very much in support of gay and lesbian rights. And I wanted to stop the medicalization of gay men, you know, who are being subjected to barbaric procedures. So I feel we've come a long way. A lot of these children, if left alone, will emerge as gender non-conforming lesbian and gay adults. Mm. We don't know how many, but a very significant number. I met a lot of women who are lesbian and gender non-conforming, and their confusions about their sexuality were not even investigated or thought about. So there's a group called the LBG Alliance, Lesbian, Gay and Bisexual Alliance, who see this kind of treatment for children as a kind of conversion therapy for potentially gay and lesbian kids. So whether you're on the left or right, most people would agree that gay people and lesbian people should feel free to express themselves and so on. Most of us would agree with gay marriage and so on. Of course, that's very, very different in the States. But it is true that within, when I was originally involved, a lot of the people who it's more easy to talk to were people in the Conservative Party. But that did change. At first, it was quite difficult to talk to people in the Labour Party. That has changed, as you can see with Wes Streeting. And it's the same with the Liberal Democrats. They've also been on the wrong side. But I'm hoping that there's going to be, you know, some change there as well. I think in the States, there is a very big divide. And of course, it's really important to someone like me that I don't get misunderstood, nor do the various colleagues that I'm working with, who all come basically from liberal and left orientations. So we're totally against, of course, these executive orders in terms of the almost a rallying cry to discriminate against trans adults. I think trans adults should be able to live their lives as they want to live them. The things about women's spaces is complex, and of course I can see both sides of that argument. But I certainly wouldn't want to be misunderstood as part of this kind of reactionary family values movement. What I'm concerned about really is the mistreatment of children. And now with this trial, I can't believe that we're going to do it again.
Just a final question. You said that the professional bodies who have to sign off trials, just for our audience and frankly for Camilla and me, who maybe or definitely do lack the expertise, obviously, that you have, what could happen that could stop this trial, given that people of your eminence are saying that it should not go ahead? Who should we, as journalists, be asking the questions of now in the medical sector? What happens next?
Well, I think you should be asking, what we need to find out. And in fact, I don't have the information at my fingertips either. The trial hasn't had the final go-ahead yet. It hasn't had ethical approval. So I think what we all need to understand is, what is that process? Who is tasked with ethical approval? How transparent is that process? And how can one make representations to the body that's charged with approving or not approving? Because, of course, I think, as obviously I would think, that anybody that's sufficiently unbiased and neutral would recognize that this is not ethical.
Well, Camilla, there is, 20, 30 minutes of such expertise delivered with calm authority. And I think both of us, and particularly you, Camilla, given how much you have been attacked for you asking and making exactly the same points as we have just heard Dr. David Bell make, that let us take the aggression out of this debate around the medicalisation of children. When I started, hearing about these discussions in the 2010s and the same time that you did, I just heard that this was about denying young people's right to be who they wanted to be. And I believe, we should have sympathy for that. And I think a lot of people like me confused sympathy for children's and young people's distress for something around changing gender. And I think that explanation we have just heard about that journey and the difference between mental health and welfare and medicalisation, I think at last, as you were saying in your questions, that dial has moved. And we should just take the heat and the anger out of this conversation, because it has not helped us.
For me, this has always been an issue about children's safeguarding. So when I used to debate this back in the day, where you literally weren't able to say anything without somebody pointing and saying that you're a transphobe and a bigot, I tried to make the point really clearly to people. I have not got a problem with transgender people. I have not got a problem with a man wanting to be a woman, or a woman wanting to be a man, or wanting to be known by a different name, or wanting them to use different pronouns. I had a problem with two distinct things. I had a problem with the suggestion that biological sex isn't immutable. I'm sorry, but chromosomes are chromosomes, and I do not believe that trans women are women. I believe that trans women are trans women. Point one. With respect to anybody who has decided to go on that journey. Point two, it was clear that this surge in referrals to the Tavistock was on the basis of some sort of trend. Okay, so I asked that question of Dr. Bell at the beginning, because if you're getting 30 or 40 people being referred for gender distress back in the 80s and 90s, and it suddenly becomes thousands in the sort of late noughties and then the 2010s, it's got something to do with the germ of an idea, then sort of spreading across a generation. The response to that is to look at why this is happening, how it's happening. It isn't to medicalise. It isn't to say at the first available opportunity, right, well, clearly this is a thing. It's weird that it hasn't been a thing for decades and decades before. Children must have somehow have changed. Quick, let's go and get a prescription for puberty blockers and make them undergo medical changes that they can never reverse without actually looking at the heart of the issue. I was also so worried about the overrepresentation of children with autism in those statistics at the Tavistock. I was one of the first people in the press, actually, to write the sort of first whistleblowing story about the Tavistock. I think it was back in 2018 or 19. As a mother, I couldn't believe that if I send my children on a school trip, I have to sign a form to say that they can be given Calpol, etc., and that there were complaints from parents that they had been frozen out of conversations at school involving their own children and their gender distress, and then put on this medical pathway that they could never get off, that might even lead to girls having mastectomies and all the rest of it. My argument was always, let the child go through the motions of what they are dealing with. If they want to change sex at 18, that's fine. But puberty blockers, without any medical evidence base that it actually helps the situation, to me always seemed like it was an abuse of children.
And I think that we should pledge that the Telegraph and our journalists and you, Camilla, and myself will have a look at this NHS planned trial. What is the body that ethically is there to sign it off? And we will put questions into Wes Streeting about whether the Health Secretary believes that the NHS should be having clinical trials of this sort.